Hey everyone, welcome to Exploring Health, Macro to Micro. I'm your host, Parker Condit. In this show, I interview health and wellness experts around topics like sleep, exercise, nutrition, mental health, stress management, and much more. So by the end of each episode, you'll have concrete, tangible advice that you can start implementing today to start living a healthier life, either for yourself or for your loved ones. And that's the micro side of the show. The macro side of the show is discussing and having conversations around larger systemic issues that contribute to health outcomes. An example that we're actually going to end up talking about today is the adoption of telehealth during the pandemic. And as my guest today correctly points out, that only happened because reimbursement codes were unlocked during the pandemic to allow doctors to get paid for telehealth visits. And in some capacity, telehealth will forever be part of the doctor-patient relationship from now on. And that's a good thing. But it brings up the question, what else could we be doing that simply isn't happening because there aren't reimbursement codes? And will we be proactive about it, or will it take another pandemic-like event to facilitate more change? So this is all stuff that we end up discussing on today's show. And my guest today is James Jordan. James is a healthcare and life sciences expert, the president of StraTactic, the national co-chairman of the Bio Bootcamp, and a distinguished service professor of healthcare and biotech management at Carnegie Mellon. James is a wealth of knowledge, and I knew that going into this interview, so I sort of had a loose roadmap for this particular conversation, and it turned into much more of a free-form conversation instead of just drilling down into one or two particular topics. Some of the things we end up going over are the positives and negatives that came out of the pandemic, how technologies can help improve healthcare access, although there are still plenty of limitations, how AI may be able to help augment the healthcare staffing issue, which is a massive issue right now, the importance of community, and we discuss this in a variety of different settings, and we also go over the concept of real-time healthcare. Like I said, this felt more like a free-form conversation than strictly an interview, so let me know if you like this slightly different format, and maybe I'll do more of it in the future. So without further ado, please enjoy my conversation with James Jordan. James, thanks for joining me. I just want to start with kind of a broad question of kind of getting an understanding of how you would describe the current state of affairs of mental health care here in the U.S.
So I think COVID brought forth the topic that has been ignored for decades. That, there have been some people, movie stars and such, and presidents that have had mental health issues that have brought it public and taken the stigma off. But the reality is that it really wasn't well known, the impact, and there really wasn't well known the gap between the number of providers and access that people have. And it's those lines are also very economically and race driven also in terms of that. And it's very urban and rural.
So I guess the easiest place to start is understanding the financial side of it. So you already mentioned that there's a shortage. Is the shortage in the mental health care space, is that worse than in traditional medicine?
I think it's about, for psychiatrists, it's about the same in terms of impact. Doctors were expecting by 2030 to be up to 100,000 in need, and we don't have it. And psychologists, it's estimated now to be anywhere from, psychiatrists, anywhere from 30 to 50,000.
Okay, so it's still very significant.
It's very significant.
And then understanding the financial implications of how this is all structured. I think a lot of people who are trying to find therapists and mental health care through their insurance are finding that a lot of people are making more money just on a cash pay basis, and they can kind of fill up their schedule that way, and they can get better. They can make more on a cash pay basis than they can getting reimbursements. So do you see any hope on the horizon, or how are we going to sort of incentivize more therapists and more mental health care providers into the marketplace, or any sort of positive light that you can glean on this issue?
Well, at this moment, I think this gap and this cash paying aspect of it probably is one of the times where, at least on the therapist and the psychologist side, psychiatrists or medical doctors and go through different training, there is an enticement of this gap to have people come into the industry. I think in the case of psychiatrists, there's still that motivation, but the cost of the training versus the return is something that people are considering. But I do think that it's becoming more attractive because it is slowly becoming a self-pay situation, whether we like it or not as a society. And that is a very simple return. And it's also a scenario where you can be, if you're an entrepreneur and want to have your own practice, you can easily do that versus, if you look at physicians since 2005, 2005, only 15% of physicians worked for groups. And today it's a much, much higher number. And so, and that's not by their desire, actually, it's economics that forced that. So it's looking very attractive, actually, from that perspective in the long run. It's just a matter of how do we help more people, and the self-pay situation is very selective from an economic perspective for certain groups that can afford to do it, but the rest really can't.
Right. So it seems to just further exacerbate the economic sort of inequalities that may already exist, where if you can afford it, you're going to be able to get it. But if you can't, you're not going to be able to get that access to care.
And who's probably in a tougher situation, a person that is, maybe struggling economically for food, water, shelter every day, or the person that, everyone's mental health issue is everyone's mental health issue. And it's always important to the individual. So I'm not suggesting that one is worse than the other, because it's all situational. But, coping with those tough living situations can be a challenge.
Yeah. That's exactly what I was kind of getting at. Can you just talk a bit more for people who aren't familiar with the social determinants of health, which is kind of what we're talking about? Can you expand on that concept a little bit?
Well, it's so funny, because if you look at Eastern religion, and they, you talk about the monks and meditation and mind body connection. This has actually been something we've known for thousands of years, and the reality when you think of social determinants of health, it's really just similar. Your circumstances affect your mental capability. Your mental capability affects your health. But people that are in violent situations. So, for example, we had done a study for pregnancy in women, and maybe helping more disadvantaged economic areas by giving them more medical care. But we didn't see from the medical care side as much of a change, because they were living in a very mentally stressful situation. These were inner city people that maybe there were gangs around and violence, and maybe parents were alcoholics and things like that. And so getting them all the nutrition and all the preventative care that one would get at pregnancy, you would think you would normalize that to, someone in a wealthier circumstance, but it wasn't the case. There's these mental health issues impact your entire life. So the social determinants of health is, when we're managing a population, all these things about safety and security and food availability all play an impact. And historically, our healthcare system has been very acute driven. You come in with a cut, we sew you up. You have a heart attack, we take care of the heart attack. But, it's a society where the most expensive healthcare system in the world, but yet we're ranked in quality anywhere from 9 to 11 in any given year. And so I think COVID really pushed these social determinants of health. Public health's been talking about it forever, but I think it really made us understand the impact of these matters.
What do you think are going to be the long-term ramifications of sort of the isolation that occurred during COVID?
That is a great question. We had a lot of friends personally whose kids were going off to college at that point in time. So we had that group, and then we had the younger group. And so we can watch both of those. But I think from the perspective of childhood development, there's data that suggests, those pre-kindergarten to third, fourth grade periods are very formative for children in terms of getting their social skills and people skills. So there's evidence that the cost of that over the past few years has delayed that significantly. And then you can see with people that have gone off to college, there's a pretty good group of people that came home and had an anxiety and decided, I'm going to take my classes back home and be with mom and dad. And they're not, as my parents used to say, adulting yet, when they really should be. And so they've been held back from that. And so I don't know the long-term implications, because if you don't get help sorting through those issues, they just sort of continue to build upon each other.
Yeah, it's going to be one of those really interesting things to sort of look back on 20 or 30 years from now, to see these kind of, like you were describing, little pockets of time, sort of that preschool group, probably the transitional period of those maybe going from elementary to middle school, or sort of starting college. probably a very strange transitional period for people during that time, because as an adult, I was adulting at the time and have tried to continue to do so, but also in a pretty stable position. Yeah, like I certainly felt it for sure. And so I'm curious, did you feel any effects of that?
So I think for those of us, as you say, quote unquote adulting, there was maybe some reflections during that isolation about our lives, what we're doing, what we take joy in, right? So you saw people that were, couples that maybe weren't happy together, sorting things out, and other couples separating, people that maybe decided to retire early or change careers, or now people wanting different circumstances. And so I think that part had some favorable aspect to it in terms of that, because we don't slow down our lives to sort of really align what we really want and all the things that we do on a day-to-day basis. I mean, even now for myself, my wife and I are working from home most of the time. She goes in 1 day a week, and she enjoys that from some aspects of it, but she is totally more productive. And for me, I'm finding that, I do a lot of science stuff. So I'm looking at slides and stained cells and things like that. And it's very easy to look on a Zoom like this and be able to see those very nicely. So I'm finding that, it's easier, but I do make sure that I go out at night to, we have certain trade shows or get-togethers, professionally in the region. I do make sure I attend those, because I also think it's important to get out there. It's easy to isolate.
Mm-hmm. Yeah, it was like that when that becomes the norm. You need to really force yourself back into these sort of social normative behaviors and start interacting with people again. But yeah, you did mention that there were some favorable outcomes that came out of COVID. You certainly mentioned that people sort of reassessing the priorities in their life, and I think that was certainly positive.
I also think people started playing with tech, right? So for me, I don't know if I have it sitting here, but there's a device called by a company called Apollo Neuroscience, and it was a group of people out of the University of Pittsburgh. And they had the ability to, they started out working with sound waves and vibration on the body at different parts to work with people that had post-traumatic stress disorder from the military. And they found it to be a very successful thing. And so since then, they've moved on to other things like rest, relaxation, de-stressing, different things like that. And I've discovered these technologies and started to use them in my life. So I've, if I need a day of focus, there's a focus component to it. I was an expert witness in some litigation, which is a very nerve-wracking thing, right? When you're doing that.
Oh, sure.
I mean, the less nerve-wracking is it wasn't about me. I was the expert, but you're still being drilled. I had it vibrating for calm on my arm. So I think those kinds of technologies and helping people sort of get realigned are important. Those aren't quite artificial intelligence. Those are just good science. But I think we have some softwares that are starting to come out in the gamification area, or teaching people to track their moods so they can realize you're off. Because I don't know if you've ever been in a situation where maybe you're a little off and you don't know it, but someone in your life says, "Hey, what's wrong with you? You've been this way for a few days," right? So I think it's some micro shifts that technology can help us with, so we never get to the point where we have these complex issues.
Mm-hmm. That's a great point. So I actually have an Apollo Neuro device.
Do you?
Yeah.
This is great.
Yeah, no, it's funny. So I've kind of carried it around. Like I got into it probably during COVID. And I definitely enjoyed it while I was using it, but it was one of those things where it just wasn't sticky enough for me. I think it was maybe how long the charge lasted or something like that, but I usually wore it around my ankle and certainly enjoyed it. If you can speak to the benefits of that or more of the science behind it, I'd be curious, and maybe some of our listeners would be too.
Sure. So you have your without getting technical, your nerve system has a fight or flight or a relaxation, and your body by its nature will go through these. But because of today with our high stress environment, we tend to be in the flight or fight, right? So if you think about maybe guitar strings, right? So you've got there's two E's in the guitar string. There's the fat, slow one, the deep one, and there's the really high pitched one. Well, we tend to operate in the bzzz, really high pitched one, right? And so the whole idea is if I can apply sound to that, or waves, It's not sound, it's waves. What I can do is I can tune it like a tuning fork. And the more you use it, the more habit you would get for balance. And so they had created some algorithms recognizing, the various uses of, let's call them tuning forks, to be able to get back to sort of a balanced role. And so I've worked for a nonprofit called the Pittsburgh Life Sciences Greenhouse. And so we had worked with them. We actually made an early investment in them. And what is notable is one of the sound waves is relaxation and sleep. And so they just put them on us in this meeting and didn't tell us what they said. And halfway through the meeting, I had to say, you guys put me on sleep, didn't you? Because I was just starting to get tired. But it's fantastic. It's really quite a technology. But there's other things out there. I'm working with a company called Mental Health Metrics that works with schizophrenia patients. And basically, if a patient gets off their medication and loses their judgment, the cost can be, $50,000 plus a year to get them back into alignment. And if you can, work with them while they still have the medication and their judgment, you can correct things. And so I think, there's more investment going into this stuff now because we do have this gap. But again, it's hard to get in a program like schizophrenia. You might get an insurance company to recognize that. But when we talk about sort of these subtler things like anxiety or, some of these traumatic stress disorders that aren't military related, insurance companies really aren't recognizing and funding that.
Yeah, medication adherence, apparently both in this like psychiatric space, but also in the traditional medicine space, there's a huge requirement, at least from people I've talked to who care about cost control. ACOs, for example, managed care organizations, they're wild. They're screaming for it. They're like, any sort of technology to help better manage medication adherence for the like disproportionately high cost that's involved when medications are not appropriately adhered to or taken. One of the other things that I thought came out of COVID that was interesting was the fact that the healthcare system, which traditionally moves very slowly, pivoted and adopted telehealth in like 3 weeks. Like when they needed to, they're like, okay, we can do this. So it was nice to see that it's actually possible to get sort of these.
So was it that, or was it that the reimbursement codes finally got unlocked? So I think it's
Yep.
Yeah. So
yep.
I mean, I think it's not that, and I think that's a fine line with telehealth. Every year I go for my physical is like a nerd session with my doctor. We talk about, different events and different things like that. And so he will talk about, listen, sometimes I just need to touch you and hear your heart and all that. But, for the most part, telehealth can work for follow-up visits and different things like that. There's a wonderful story that shows how impactful this can be. I think it was in the Post-Gazette here in Pittsburgh, but University of Pittsburgh Medical Center is one of the best Hillman Cancer Center is one of the best cancer centers in the region. And so obviously people come literally from 6-7 hours away to get treated. And it was the story of, this elderly couple that would have to come into the city for their post follow-up. And the reporter followed them, and it was this, multi-hour journey, and getting treated or getting seen and multi-hour journey back. And sometimes they would stay overnight because they were too exhausted, right? So there's economics there. They're old, it's exhausted. And so UPMC recognized that and put up these, I wouldn't call it, I don't know what they call it. It's sort of a telehealth center, but it's manned with one nurse who can take the vitals and do some things and just, be able to video in. And it worked amazingly. But what has stopped that for years is there was a lack of payment for people. So if you did it, you didn't get paid. And it's not to suggest at all that healthcare providers are greedy. They need to get paid. I mean, most operating margins in hospitals are less than 4%.
Yeah, no. And then kind of during COVID, most of the elective services, the elective surgeries were postponed, and those are the biggest money makers, kind of the get you in 3, 4, 5 days, get you out, kind of that quick rotation. So, they're still dealing with like the long-term consequences of that. And small independent hospitals are just hemorrhaging money right now. But it's a great point that you brought up. If these people can't get paid, it's probably not going to happen. Like most doctors do have very good intentions about like what they want for their patients. But we operate in a system where, it's not just a simple, I can pay for this. It's the reimbursement has to be there from the insurance side.
Yeah, the system, the concept in just-in-time manufacturing called non-value added, and the thought process is that anybody who's not touching the product is non-value added. So you should be supporting the heck out of them, and do what you can to cut all the other stuff and make life as efficient for them. And when you think of that in our healthcare, it's nurses, it's doctors, it's psychiatrists, psychologists, or they're the frontline people, and yet they're the ones that are struggling with this situation. And so I think it behooves all those that are, I have a podcast myself called Chalk Talk Gym, and it's oriented towards the business models of health systems. And that's the United States in general. And so we could go on for hours about that. But the crux of it is that, people need to get paid. If I'm the brightest mind in the world, the average physician was making so much more 10 or 15 years ago. And, as a friend of mine always says, I want my physician to be the smartest, most highly paid person in the room, right? And so they put a lot of time in, but those people can take that energy and that intelligence. They can go to Wall Street, they can go to other places, have a much less investment and a much higher opportunity. And so, almost everyone that you meet that is in this business is in it because they want to help people. That really is their primary motivation. But we're pushing them out, particularly nurses at this point in time. We're just exhausting them. And, we need to find ways to relieve that.
So when it comes to like mental health care in the US, is there anything that's disappointed you the most, maybe over the past 5 or 10 years, from an infrastructure standpoint, a care management standpoint, just something that you've seen where it's like, we could be doing a lot better here?
It's mostly the access. People do not have access. And if you're can't self-pay, you're not really going to get the access, or you're going to get the quality. And then for those public health situations where they are nonprofit clinics, we have some around here. There's just not enough capacity, and the people that are working there aren't paid enough. So we need to figure out a way to maximize the work with the people that we have. And this is where I think artificial intelligence and gaming models and some of these other subscription models can be helpful, because what you're trying to do is get someone a program, you're trying to give them feedback, and then you're trying to monitor them. And so are there ways with technology that we can do all of that at a much lower cost than it would be to see people one-on-one?
Yeah, so I'm going to go back to telehealth for a second, because I think what you mentioned is relevant, where you were saying, like, is it appropriate all the time? And during COVID, like, there wasn't really a choice. Like, people needed answers to questions, and we just couldn't do it in person. So it's what was available. And it's still incredibly early from, if you expand the timeline, we're very early into the life cycle of telehealth, if you will. So we're still figuring out like the best use cases and the most efficient use of it. But I think it is going to end up being a mix of which types of providers can offer telehealth and operate in telehealth, and then which types of providers and practitioners are needed for the in-person visits.
Well, even niche, I met a woman a few years ago who was practicing out of California that worked with only sexual addiction and transsexual issues. And she was, one of the few people in the country that could do that. And so someone in, I'm making this up, Idaho could have access to having a session with her online, like you and I are talking right now, and it can be very, very effective. So it's not only can bring the cost of the treatment down, but certain people specialize in certain things around the country, and you can now not have your geographic location limit the quality of or the specialist that you could meet with.
Yep, that's a great point. So I was also thinking of like that's what I see as like good potential and good opportunity in the future, especially around mental health care. You're talking like technologies. So I think it's like what technologies can help in those early stages and sort of like those lower level thresholds where it's not necessarily, I need a therapist, I need a psychologist, I need a psychiatrist. It's like what sort of management can be done at a lower ongoing level by technology or AI or some sort of augmented technological service like that.
Or how can people manage themselves? So one of my former students is with a company called Twill, Twill, and they have a section, one of their sections in their community model is women with postpartum depression and just women who've had babies, and they start out sort of in a chatty area, but then if they have various issues, they can go learn about it. They can find ways to work their way through it, and at no to little cost, and then move up to a pay model if it's something that's more severe. And I think that's important. My wife has a very special story. So our youngest, who's now 25, when she had her child, they had these online chat pages. So we're going back literally 25 years, right? And so she met these group of women online, and they've remained friends for 25 years. They all know each other's children, and they benchmarked each other as their children were growing up. And so one of them had an Asperger's child, but of course, when the child was really little, that wasn't known. And these women could benchmark their children against her children, and she was able to, maybe get her child some help years and years earlier. So that's a 25-year-old story. That's a very crude, obviously non-technology story, but it shows what, having community and benchmarks can do to help you make your own decisions.
Yeah, I think the community aspect is really interesting. It's probably one of those things I undervalued for a long time. I've always described overall health as having like 6 pillars, if you will, like exercise, sleep, nutrition, stress management, daily physical activity, and then the last one being community or some sort of connection, if you will. So I've now kind of reprioritized that one much higher on my list. I'm not saying any of them, like you need them all, but I'm like much bigger on connection at this point.
What's interesting is you say that, and I listen. So I started yoga. 60. I just finished my 60th class, so relatively new.
Yeah.
I was talking to someone yesterday, and they said if you go to yoga 3 times a week, you change your body. If you go 5 times, you change your mind. And so I've been going at least 5 times since August 1st. And as I listen to you, it's got a social aspect to it, right? So there's community there. They stress, breathing and looking at your mind-body connection, which is, I was just going for stretching. And then I'm getting, some pretty good physical exercise. And so I'm getting all 3. And if I don't go on a particular day, I feel a little off. And so I think, we underestimate how you can bring 3 of those together. And my sister, of course, my sister has a kind of a funny story about exercise. So when she had her child, and she, of course, she had 4 older brothers, so maybe there's a context to this, but she had postpartum depression, and she had read that exercise could work. And so she would go out jogging, and she would be running down the street crying, and the neighbors are saying, "You okay?" She goes, "Yeah, I just have postpartum. I'm going to work it out." And God bless her, she did, right? She just kept running and running and running. And so, how do you know that those things would make? I wouldn't have thought yoga would have made me get this community aspect after working from home, as we were talking about, this mental health. My blood pressure's gone down, my pulse has slowed down from my Apple Watch during this time. And I don't consider yoga like, running exercise. It's a little different, but it's pulling that together. So I think your 6 pillars probably have a couple circles in them that intersect as opposed to being pillars,
Oh yeah. Like it's hard to describe a model, but there's tons of overlap, and you can't ignore one and pretend it's not going to affect the other 5 and things like that. But yeah, I was a personal trainer before kind of starting this company, and I was not always poo-poo-ish on yoga, but I just didn't look at it from the right perspective. I thought of it as like, oh, it's good for stretching, and it's kind of like a low level strength activity. Where I was like, oh, if you want strength, you can better prioritize your time. And I was always in like, stretching's not that important from like an injury prevention standpoint. I still stand on that, but from the connection standpoint, and some of those positions are just very challenging. I'm like, oh, you really have to be in the moment. You have to be there with your breath, with what you're feeling.
That's really interesting you say that. So when I lift weights and run, I have headphones on. I'm listening to an audiobook. That's not the case in yoga. And of course, I'm much older than you. And so for me, being at the desk for so many years and balance and things like that are important as you get older. And that was actually my original motivation. I just felt myself, sitting down with the dog and getting a little harder to get down, or, a little tight in the morning and things like that. So it's an interesting connection for sure. I don't know if you know this because I didn't put this in, but I'm a certified hypnotherapist, and I more use it for business reasons. I don't do one-on-one sessions, but a lot of what hypnotherapy is about is you connecting external events to some internal state that isn't true, right? And so what a lot of these population health models that can bring information to you help you find for yourself where things are disconnected. How are you feeling this way, during a divorce? How are you feeling this way if you failed a test? You have a tough situation at home, you think you're isolated and you realize, no, these are natural feelings, and then you can find ways to correct. So I think a lot of times we first find out that something's wrong with us and we feel abnormal in the first, a lot of times when people have some sort of unknown disease, when it gets diagnosed, they feel better. Nothing has changed. You have the same health rights, but you feel better. And then when you can label it, you can maybe do something about it. And so I think some of the technologies can help with that and do so in a cost-effective way.
Yeah, and kind of goes back to community where, if you can find yourself a community of people who are dealing with the same thing or going through the same thing, you realize, be like, oh, this is a very normal human experience. Like, I'm not abnormal. This is a very normal part of life. And I may not have the tools to necessarily move forward in the way that I want to yet, but you can certainly acquire them. So I think there's a huge education piece of kind of getting people to understand these are not abnormal states or anything like that, to sort of normalize it a bit more. And that's where I think technology can be really interesting. So I want to pivot it a little bit to talk a little bit more about AI. Where do you think AI, or what are you most interested in from an AI standpoint over maybe the next 5 to 10 years?
So I think that the excitement in the privacy security issues sort of overlap, right, on these things. So I think, my dean at Hines College would always say that technology always moves faster than society can handle it. And it has these series of pauses where there's rules and regulations and different things that come up. And we've seen that in, automatic cars and vaccines and certain things over time. So I don't think that this is going to be terribly different. So I think over the next few years, we're going to see AI really be good at what I would call the efficiency things of healthcare, scheduling calls, chatbots, different things like that. In the schizophrenic example I gave you, being able to tell you that you're drifting and maybe be able to inform your doctor on that. So I think what it's going to do is it's going to help identify, and it's going to give people that are either challenged economically or people that are very mild in their situation, the ability to self-manage. The long-term hope is that, we learn how to you've heard the concept precision medicine. So the concept for your audience, precision medicine, is that my genetics can tell me what's medicine is best for me. And in any disease from, 0.0 to 0.25 in any progression of a disease, I'm going to be at different points between there. And when you combine my genetics and you combine the point I'm at, I might get some specialized treatment. And I think precision medicine can be applied. The concept can be applied to, we'll call it maybe for this podcast, precision psychology or psychiatric. But I think that's where we're going. But I think we're ways off from that. And if you even talk to psychiatrists about the meds that they use, they know they work. They don't necessarily know why they work. So I'm working with a group of professors now. I don't know if they'll get this grant or not. But if you remember when we were in high school, we had sort of the tails of the distribution, right? So you had a normal distribution, little tails on the side. And the tails on the side were odd stuff. And so I think what this project that I'm working on is intriguing by me is we have neuroscience, immunology, and a bunch of scientific disciplines coming together. But when they're doing their research, they're interested in the centers of these pieces because they're interested in their technical question for their specialty. What they've all been ignoring for years is the tails of the data. And so their proposal is to pull all these tails together and see if it gives us a more holistic concept. and evidence on what the right things are to do. And so I think that's the long-term future. Just like you and I were talking about the community with yoga, it could simply be, an Apollo device for vibration. My brain is missing a certain chemistry, right? And it can put all those things together and have a more holistic and balanced approach. But I think that's 10 to 20 years off.
Sure. Yeah, it's also hard to project with how quickly things are moving. But then there's also
I think what's going to happen
of
is
existing systems.
Yeah. Well, what's going to happen is we're going to have that evolution of stopping for regulations and guidelines. I mean, the FDA is starting to recognize, okay, what happens when artificial intelligence attaches into the tools that we already have approved, right? So people do their studies and they have these tools and they've proven to the FDA that it works. But now you sort of have something coming in and potentially interfering with that system. We hope that it augments it, but it could also deteriorate it. And so I think that we don't know what that stuff means, and we're going to have to sort it out.
Yeah, it's hard. It's messy. I don't envy the people who have to figure that
messy.
out.
That's a perfect world, because I think the brain is messy, right?
Mm-hmm.
It's not like a broken leg where it's very clear there's like 2 things we can do or 3 things we can do here.
Sure.
It's much more complex than that.
Do you think there's going to be a beneficial shift towards preventative care and prevention?
I still don't think our healthcare system, I mean, we've got some codes for that and stuff, but I think in general, it's really going to be, I think the next generation, and I say next generation, the non-baby boomer generations are more comfortable with online self-care and managing themselves. And so it's going to be interesting to see where that goes, if that trend is statistically significant, that it could move the dial. Because I think there's this concept of a real-time healthcare system, and it's been around for a long time, but it came up again during COVID, where, population health and public health is sort of a health self-defense in the government, right? Which is very different from the health system that has, acute behavior. And I think we need to bring them together and have insight from both sides of the system. And I don't think we spend money on the population public health aspect of it, which might be, the better improvement. When we say we send a rocket to the moon, how many little adjustments it makes to get to its target. And if you waited, every hour or so to make those adjustments, it missed the moon by a million miles. And I think that holds true for populations. And so I think an investment in that area can change those micro adjustments are not as expensive to do versus a big moonshot miss. But we just don't have the data to prove that to healthcare insurers and the government and people in general.
Yeah. I mean, I think at least on the insurance side, feel free to correct me if I'm wrong, but the portability of risk in the US is too easy, where if you change jobs, you might get a new insurance company. So it's like how much investment you're really going to put into risk that you might not be carrying 3 years from now. So I think that's always an issue. What do you think patients can do to help drive change in a positive direction, or what can patients do to be their own best advocates, if you will?
So I think we kind of see that clashing of that right now post-COVID. So if you remember, if you go to the doctor during COVID, they told you to wait in the parking lot, right? They made a nice, easy sign-in process for you. And you got called in, you went right into the room, and the doctor came in within a few minutes, and we weren't all queued up like we had historically been queued up. And I think some places have gone back to the old way. Hey, I don't care if you're sitting in the lobby for 45 minutes. And for the first time, you can see people complaining, and you can see people actually changing providers. And so, I think people need to stick up for themselves. But I also think that people need to take responsibility for their own health and educating themselves in their own health. So one of the things that's great about, ChatGPT and Claude and Bard and all those things that are out there, of course, it's all how you ask the question, because they want to make sure you don't, they're not behaving as a doctor. But you can find stuff out. I was talking to someone that had a PFO in their heart, which is a small hole, and what treatment can be done. And their first response from their doctor is, you're too early to treat. Well, they went online and they read everything on it, and they recognized that, the code to get treated is a stroke. This person's in their 20s. They're like unacceptable. So I think that pushing back and taking responsibility and being assertive is important. Now, the challenge to that is, we all generally are held somewhat hostage to our health plans, right? So that's the challenge.
Yeah. And I think there's probably, again, like an adjustment period where there's so much information available now, and like everyone can have a platform and a voice. So there's trust issues, there's misinformation issues, there's malinformation issues. And I'm sure doctors are getting inundated with, I read this, I heard this, somebody so-and-so said, where in addition to them having to do their jobs in an extraordinarily short period of time, they're also having to filter out, is this coming from a reliable source? Do I need to take them seriously? Without being dismissive to the needs and, the requests of their patients. So I think that will
really
normalize.
Hard to, so my neighborhood's, we have 4 daughters and they're all older now. So you forget what it was like to raise a family. And so our neighborhood's turning over, and we have a lot of young families in our neighborhood. And I just watch at the consumption of time that it takes. And so, it's really hard to have a full-time job, have a full-time family, and take time for yourself. And there's lots of evidence that, in electronic health record maintenance and things like that, mothers will just make sure those records are perfect, but they won't take the time to correct their own, right? Fathers working 3 jobs and not having time to work out. One of my neighbors is, works his tail off, and I've seen he's been here for 3 or 4 years now, and I can see him putting on weight. It's just, not having that time. So, we can say take care of yourself, but again, life's more complex than that. When they say take care of themselves right now, it's their 5-year-old and their 3-year-old that they're taking care of. So it's hard to take care of yourself, but I think we tend to take care of ourselves a little bit more when we know we're drifting. And that's where some of these tools like, I've noticed lately people wearing the blood glucose monitors who don't have diabetes, just track. Yeah, really? You are? Yeah. So I think that's interesting, right? What motivated you to do that?
So it's more so for our company. We're integrating with Dexcom and Freestyle Libre. So one of our other employees, we got a Dexcom a Freestyle. So they're testing that. It's making sure our integration works correctly. So I'm just doing it to make sure our software is working the way it should be. But so even before
in my case, I don't have one of those, but I have the good old fashioned stick your finger one in my closet, and I just do it once a month, and I keep it on a little spreadsheet. Yeah.
Yeah, it's just some of the things you can do to start kind of being more informed about your own health. And I think also having larger volumes of data on yourself, it reduces the probability of outliers. Like if you go to your doctor once a year, I get concerned that we're making a lot of big life decisions just on one data set, one snapshot in time. I think there is going to be more continuous data is going to be important for the future.
I agree. I think, every time I go, they're like, well, your blood pressure's high. It's like, well, that's the white coat disease. And I'll pull out my app where I measure myself at least once a week. And I'm like, okay, it's been, 125 over 74 for the past year. And he's like, oh, okay, well now, but even for them, right? I mean, you're saying that, that visit, they don't have any other data otherwise to know, right? So in my case, I can produce it. And then he had asked me on my next visit to bring my cuff so he could calibrate it, right? And it was, just to him, to calibrate it to him, and it worked. It was calibrated. So he's like, okay, I'm fine. But, again, I go back to thinking of, more middle-class blue-collar people that are working a couple jobs to keep things going. And, the only thing they might have is some technology that tells them they're drifting because they actually don't have time in their lives to reflect on it.
Yeah, that's totally reasonable. It's nice to be in a position where you can have a blood pressure monitor and you're not stage 1 hypertensive and you're just doing it because you're being proactive, or same thing with blood glucose. It's a privilege to be in that position.
Mm-hmm. Yeah. And so, when we talk about population health, the top 1% who have money are going to, be able to pay for things to be able to get what they want. It's the rest of the country, which makes up the whole idea behind public health is that a healthy person produces gross domestic product in the coldest economic perspective, right? So there's things that we do as a country that just does not make sense. We'd rather spend all this money over here as opposed to making someone productive or having healthcare that covers their injuries and their issues. And I'm struck by, I was at my nonprofit in the south side of Pittsburgh, and it was a beautiful sunny day, and someone's letter came to our address, and I noticed it was a couple houses down. So I decided to go down and knock on the door of this old brownstone, and a woman came in oxygen, and she's got her walker, and she invited me in for tea. She was a loveless lady. She was so insistent that I felt I was rude otherwise. So I went in and I had some tea with her, and she told me she was only 60 years old, and honest to God, she looked like she was 80, and she's struggling with oxygen. And she tells me a story how her son went off to college to be an engineer, and he had now moved back home to take care of her, and he wasn't there right now because he was off at Burger King. And so, not to suggest anyone working with Burger King is a bad job, because it's not, but this person had the potential to be an engineer. And now he was giving that up. And what that meant was the mother's disease affected that son and his next generation, and maybe his potential in the generations after. And I don't think we think about that as we think about applying healthcare in this country.
Yeah, no, I think we do tend to be pretty short-sighted with our healthcare decisions in this country. So that does lead me to what's going to be one of my last questions. I do want to be respectful of your time, but given what you just said, do you think we're going to move towards a single payer system? No.
Too many lobbyists and lawyers and accountants. And it's hard to say whether that's a good thing or a bad thing. I will say I interviewed someone for my podcast who had done drug development all over the country, all over the world, so in Europe and all that. And we think of a one payer system, but a lot of those countries have a second payer. Mm-hmm. So if you go to France, you can have private insurance, and you can have private plus, right? Yep. So the private plus is intriguing because it sort of separates that issue of our society should have a minimum health level, and then if you can afford more, you should be able through capitalism to have more. But I think that the big benefit that I saw in interviewing him was there was one billing system. And I was talking to a doctor the other day, he's got 34 different unique ways of billing for his patients in New Jersey. And that's complicated, and it's expensive, and it's a waste of time. And so if we could, maybe we won't get to a one payer system, but if we could get to one level of paperwork, that would reduce administrative investment so much and put it back to the patient and the doctors, the nurses, psychiatrists, psychologists.
Yeah, it's nice that we can circle back to this concept you brought up earlier, which was the non-value added. I had a note written down. I'm not sure of the exact number, but I saw something on LinkedIn a while ago. I think it was something to the effect of 68 cents of every healthcare dollar is not going towards healthcare providers.
I know it's above 60.
Okay.
So I think you're probably correct in that.
Right. So that's just an astronomically high number. And I get that healthcare is complicated. I think we've made it as complicated as possible, but that's not a challenge to anyone in the U.S. healthcare system to
I found it amusing when they were talking about recently the unions had negotiated with the car people, and they were saying, it's going to be $900 more per car. And I thought to myself, okay, so what are you doing to reduce the people that aren't working on car dollars to make up for that? Because again, the talent of the people working on cars, right? Obviously there's designers and things in the background, but how many dollars in your car are those other people?
Yeah, no, it's a great point. Do you have anything that we've talked about today? Do you have any additional resources you'd want to point people towards to sort of learn more? I know this is sort of a meandering conversation, but tends to be how they go here.
So I think, just to timestamp our conversation when you put it out, 2 days ago, President Biden signed an executive order on artificial intelligence and getting a group of people to figure how we can have the benefits without the downsides. And so I think at this point, we don't have a lot of information on this, that it's very nascent. And, you and I don't know what's going on behind ChatGPT and all that. We just know sort of it works, right?
It's a clever
we also know
box.
it's full of bias. We know there's all sorts of issues associated with it. So I think we're really at a very beginning time frame of understanding this.
Yeah.
So I don't think there's one place you can go at this point in time.
Yeah. I think just to continue to have these conversations will be very beneficial. Is there anything you want to add for sort of closing thoughts to wrap this up?
No, I would just add that the people that are interested in understanding the business of healthcare, I have an academic website called healthcaredata.center. So instead of .com, it's .center, CENTER. And I have information up there on physicians, pharmaceutical industry, medical devices, gamification, all these things. So any one of your members of your audience are interested in those specific topics, you can probably find something there.
Great. Yeah, I've spent quite a bit of time looking through you put out a lot of information, which is great. And I also have your press kit. So we're going to link to all your social websites and also all of your work websites as well. So we'll make sure people can find you if they are so inclined to do so.
Very good. Thank you so much.
James, this has been a really fun conversation. I appreciate you coming on.
All right. Take care.
Hey, everyone. That's all for today's show. I want to thank you so much for stopping by and watching, especially if you've made it all the way to this point. If you'd like to be notified when new episodes are going to be released, feel free to subscribe and make sure you hit the bell button as well. To learn more about today's guest, feel free to look in the description. You can also visit the podcast website, which is exploringhealthpodcast.com. That website will also be linked in the description. As always, likes, shares, comments are a huge help to me and to this channel and to the show. So any of that you can do, I would really appreciate. And again, thank you so much for watching. I'll see you next time.